Welcome. You are listening to the Birth Words podcast. This is episode number 37. And in today's episode, we're going to be talking about a linguistic concept called discourse and what that looks like in the realm of birth.
You're listening to the Birth Words podcast. Utah-based birth doula and applied linguistics scholar Sara digs into the language of pregnancy and birth to help expectant women claim their power as life-giving agents engaged in a praiseworthy work. This podcast aims to promote positive birth paradigms and is not intended as medical advice.
We are going to talk today about a man named James Paul Gee. He is a notable linguist. He's still around today. He did a lot of work in defining a term called discourse. So Gee differentiates between little d discourse, as in the word discourse spelled with a lowercase d, and big D discourse, as in the word discourse spelled with a capital D. So little d discourse is simply language in use, that is, in its context. And I say simply, but it's really not so simple. We can analyze language within a specific context, and that is called studying discourse. Then G talks also about big D discourse, which he uses to include not just language in a context, but all of the other semiotic systems at work in that context. So you remember in an earlier episode, we talked about how language is a semiotic system. It's the use of signs, symbols, words are really signs or symbols, to communicate meaning. And G talks about how the words we use are not the only things that communicate meaning in a given situation and that come into play when we're communicating. So for instance, police discourse, big D discourse, includes not only the way that police officers tend to talk officially, what types of words they tend to use, the way they tend to structure sentences and phrases, but also the police uniform, the police car, values that are typically held by a police officer, and behavior that tends to go along with a police officer. So G talks about how when you think about what big D discourse means, it's basically what would you need to imitate to pull off impersonating somebody in a different, that isn't who you are. I think he talks about being like a mobster or something, and how if he said the right phrases that are typically used in that context but wore the wrong clothes, he wouldn't be taken seriously. Or vice versa, wearing the right clothes, saying the wrong things, not following all of the different sign-giving systems that indicate identity and how you operate within a context. So let's talk about the two big D discourses as they relate, or that come up a lot in birth. So I say two. I think that many who work in birth would agree that there are two prominent discourses, but also that they're not wholly separate or different from one another. So one researcher, actually two, working together, put it this way: people who work in labor and delivery are fluent in two dialects. They can converse in either, and they can talk reflectively about and across them. So what are these two dialects, as McCaffrey and Mannion termed them, or discourses, as G would term them, and as I'm calling them today? The first is the medical discourse of birth. It includes things like terminology that's used more in a medical birth setting. It tends to take place in a medical scene, in a hospital, or during pregnancy in a physician's clinic. Terms are used such as dilation, effacement, contraction, pain level, fetal tracings, amniotic sac, gestation, amniotomy, cervical change, and lots of others. Many more complex and jargony than the ones that I listed. It also comes with other contextual factors: scrubs, a hospital bed, hospital equipment, interventions that are commonly used in this setting, such as epidurals, such as amnio hooks to break water, such as fetal and contraction monitors for tracing fetal heart tones and intensity and frequency of contractions. Along with this discourse, this package, comes beliefs about when intervention is good or needed, the role of a care provider in relation to the patient, who, in this situation, a birth giver is positioned often as a patient in this discourse. There are beliefs also that tend to come in this package about the ability of the birth giver to birth without intervention, who is in a position of authority, and what is the nature of birth. And I'm not going to spell out what each of those beliefs might be, because they are unique to each individual practicing within this discourse, and it's not necessarily true that they come as a package and each care provider has all of them. But the language used in this discourse often reflects the prominent beliefs and values that are found within this discourse, which this discourse tends to see birth more as a medical condition that needs to be treated. And I want to thank Dr. Stephen Ruchar of Flow Chiropractic in Lehigh for his help with this terminology that differentiates between these two discourses. The medical discourse, again, is the discourse which sees pregnancy and birth as a medical condition to be treated, whereas the other discourse that I've been referring to is a physiological discourse, which sees pregnancy and birth as a physiological process to be supported, in contrast to that condition to be treated. So moving on to this second discourse, physiological birth. There are terms that come along with this discourse. And again, these terms are not used by everyone within the discourse, and there's a lot of variability, but terms like wave and surge instead of contraction often are found in this discourse. Sometimes people in this discourse speak of opening rather than dilation, as it has a more natural connotation. Some within this discourse tend to differentiate between the intense and powerful sensations felt during labor and pain. They don't identify the uterus's contractions or waves or surges as pain, but rather as pressure, intensity, and something that's acknowledging that the body is doing the work that it needs to do. Whereas pain tends to convey the opposite message about what's going on in the body. Pain is normally indicative of something being wrong in the body, something that needs to be fixed. Whereas in the birth process, physiologically, pain is the intensity of those feelings is not an indication that something's going wrong, but rather that the body is working just as it should in this process. Also within this discourse, it comes along with other contextual factors. Scrubs are not worn as often, maybe more of just layman's clothes. Birth can take place in a hospital, and this discourse can be used, but often this discourse is found in a home birth or a birth center birth. There may still be some of the same equipment and interventions, but not many of the same. And there are different beliefs within this discourse about intervention and its role, when it's good, when it's needed. There are different beliefs about the role of a care provider in relation to the client, as they're normally called in this scenario, in this discourse. There are different beliefs about the ability of the birth giver to give birth without intervention. Who is in a position of authority, and what is the nature of birth? So these two discourses operate in a parallel way. They also intersect all the time. The two discourses can exist in the same place at the same time, and sometimes even in the same person. Or a person may subconsciously, without realizing it, be speaking the language of one discourse while identifying themselves or finding their beliefs within the other discourse. So throughout this podcast, we'll come back to this concept of discourse, and we'll keep thinking about what our language reveals about our underlying beliefs and how we position birth givers and what the role of authority figures is. And so I'm excited to keep going with you on this journey as we look at language and birth. See you next week.
Did words play an important role in your birth experience? If you're interested in sharing your story on the podcast, go to www.birthwords.com. If you're liking what you hear on the podcast, please leave a review on your podcast app. For more resources about harnessing the power of words to benefit the birth experience, visit birthwords.com.